Thank you very much.
Yeah.
Thank you.
How's the second week been?
Let's pick it up.
Yeah.
We already have 3 floors closed. The units are open. The units are full.
Hey.
It's nice to meet you.
Oh, thank you so much. I tremendously appreciate it. The respirator that we got in our first kit, I used for many shifts during COVID. The additional gown, the hand sanitizer, it's been all put to great use.
When it comes to medical facilities, for example, in lower income neighborhoods or serving underserved communities, oftentimes they don't have access to the funds they would need in order to basically equip their staff, or even nursing homes as a really good example, where the healthcare workers are still struggling with PPE and don't have the same access. I feel like we know so much about you and yeah, right?
Yeah, of course, yeah. Colleagues are good, morale's good.
Morale, I think, is the same. I think a lot of us are tired because we've been working throughout the pandemic, so but we haven't staffed. In the health centers, that is still a problem as far as finding PPE and having the proper amount and the proper kinds of N95 so that when we are seeing patients, because now we are seeing more patients in the clinic live and we're in the room with the patients, so it is still a problem for us to have to reuse N95.
After I recovered, obviously I was really grateful, but I also heard a lot of stories from my cousins who were really concerned about getting COVID, being that they were healthcare workers. I have 7 cousins in the tri-state area that are nurses. A lot of them are in the ICU, a lot of them are in the ER. So I wanted to try to help them.
So I'm packing a PPE supply kit right now, and this is what we put into it. We have 2 face shields, reusable isolation gown, reusable surgical cap here, protective goggles, glasses, also protective, 5 ear savers, 2 of these 3M N95 masks.
Every day when I go to work, I feel like a sheep going to slaughter. My colleagues and I are writing our last will and testament. I'm 28 years old.
I remember reading and hearing all this news about healthcare workers not having the proper access to PPE. And I just remember thinking how unfathomable it was to essentially have all these essential workers on the front lines treating COVID patients, potentially putting themselves at risk, as well as putting their loved ones at risk when they went back home, and them not having access to PPE. So for me, that's personally why I was motivated and driven to co-found PRI.
Yeah, you guys help almost hundreds of people here. It's really,
It's great. Every time we come here, we're like, oh, how did you find out about us? They're like, oh, Fernando
I hope
told
you guys
us.
don't mind me telling everybody.
No, we actually, over at PRI, we call you a champion, a PRI champion, because honestly, that's what you've been.
I've done over 400 deliveries myself, and I always asked them, how are you doing? What I've heard has been so inspiring, you know? Yeah, they're really scared, you know, there's a lot of anxiety that they go through. some of the healthcare workers I've supported have came down with COVID themselves, but they always remember why they became healthcare workers in the first place, because they genuinely care about the community. And we just wanted to show to them, that there is another community out there that does care about them as well.